In 2012, Better Health Greater Cleveland's data uncovered dramatic improvements in blood pressure among primary care practices at one health system, HealthSpan, which at the time was Kaiser Permanente of Ohio. This improvement led them to have up to 90% of their hypertensive patients under good blood pressure control. What really stood out in the data is that HealthSpan's high rates of good control were high for all its hypertensive patients, including African Americans, whose improvement has persistently lagged behind white patients. We learned that Kaiser, now HealthSpan, had adopted a deliberate strategy that drove its results. This strategy has been presented by their clinicians at several Better Health learning collaboratives. We began working with Kaiser to translate this best practice into a practical curriculum that busy practices could learn and implement, no matter their staffing models. The result is our development of 6 one-hour monthly sessions that Better Health's lead practice coach, Bonnie Halopeter, and I are taking to interested clinic sites. So far, we have about a half a dozen interested clinics. The curriculum helps practices improve 5 key elements known to improve blood pressure control. The first key element is accurate blood pressure measurement. The second is a treatment algorithm that makes use of effective, low-cost, once-daily medications, which improves medication adherence and simplifies the broad array of treatment choices for providers. The third element is nurse or medical assistant-led hypertension visits, which occur monthly until the patient's blood pressure is controlled. The fourth element is cultural sensitivity training to help clinicians and staff communicate more effectively with their African American patients. And the last element is outreach to patients with elevated blood pressure. Like other best practices we have disseminated, we anticipate seeing good results in the coming year from Better Health's collective efforts to reduce disparities in blood pressure control across Northeast Ohio. If you are interested in learning more about the program, Bonnie Halopeter can be reached at 216-778-8587.